The first question you ask yourself is, what are the areas of occupation that my child is struggling with? Is it self-regulation, sensory, motor skills, routines, organization? Hello, and welcome to Growing Strong Roots, an occupational therapist's perspective on parenting, self-regulation, and resilience. I'm your host, Leanne Bloom, owner and occupational therapist at Oak Bloom OT in Oakland, California. I want to start out by sharing with you what OT actually is. At its core, occupational therapy is how people occupy their time, which can be really broad and can include almost anything. For children, it might be how they participate at school or at home. For adults, it could be work, caregiving, or engaging with their community. What matters most is that these activities facilitate their ability to participate in the individual's everyday tasks. In occupational therapy, we aim to identify the barriers that prevent someone from living life to the fullest extent of their abilities. We consider a variety of factors, including age, goals, environment, and what the person really wants or needs to be able to do in their daily life. Taking all these factors into consideration, we tailor our therapeutic approach to each individual receiving OT. Occupational therapy can look different depending on the person and the setting which services are provided. We use real-life activities, or occupations, as the pathway for growing, healing, and skill building. These skills are always considered within a developmental context and are influenced by the child's age. As a pediatric occupational therapist, we look at developmental timelines to understand growth as measured by what the child is able to do. OT may address delays in fine motor or gross motor skills, for example, walking independently around 14 months, putting on socks independently around age 3, or managing personal hygiene around age 7. When children have difficulty meeting developmental expectations, occupational therapy may be one valuable resource to support them in reaching those goals. In private practice, occupational therapists have the opportunity to address a child more holistically and consider a wide range of factors that may be contributing to limitations. The person's abilities may be different compared to other children, depending on a number of factors such as diagnosis, environment, exposure to tasks. Common barriers to reaching one's potential can include a mismatch between a teacher or parent's expectations and the child's abilities. This mismatch can occur in either direction, when the expectations are set too high or too low. In my private practice of occupational therapy, we help families and schools determine what is age appropriate and developmentally expected for a child of their age and ability. Parents may not know what's expected developmentally of their child. Additionally, they may not be taking the bird's eye view of how helping their child in the moment may be interfering with their independence. They also might not be seeing it from the other direction, that their expectations are too high for a child who may have barriers such as challenges with emotional regulation, sensory overwhelm, physical limitations, or undiagnosed mental health conditions. I'll give you an example of both scenarios where there's a mismatch of the parent's expectations of the child's ability. These concerns can show up at school, at home, or in both environments. In the first scenario, the parent is underestimating the child's ability. The parent feels like they're being a good parent by helping their child, but often it's enabling the child not to grow and learn independent skills. Often in my practice, parents will put a child's shoes on to get out the door from OT. I know the child has the ability to put their own shoes on, maybe even with a tiny bit of help, but they can mostly do it themselves. For example, I have a client who's 8 years old with autism. The client complains to the parent, refusing to put his shoes on himself because the child is used to the parent doing this task for them. We need to be empathetic to the parent and keep in mind that the teacher-child or OT-child relationship is different than the parent-child relationship. Children often do more work and with greater effort for a teacher than they will for a parent. However, the child is always growing and learning, gaining new skills and abilities. Yet as parents, we can get stuck in a historical conception of what the child's able to do, and often can do more than what they let on to be able to do. My job as an occupational therapist working with families is to empower parents and children to gain confidence in their skills with daily tasks, to teach them how to be independent, like for the child to be able to put their own shoes on. In a future episode, we'll talk about letting children do hard things and how letting them struggle is important to their development. This could be very difficult to do as a parent. And what is our job as a parent anyway? Do we want to create dependence or independence? Whose job is it to teach children daily life tasks that they don't automatically learn on their own, especially if they have autism? More on this in a future episode. To address and improve skills and decrease enabling the child, it's helpful to observe the child doing the task to see where they're getting stuck. Sometimes the observation has to come from an unknown person, like an occupational therapist or a teacher. That's why sometimes I'll observe a child in their own natural environment before bringing them into a clinical environment. I have an opportunity to be a fly on the wall and not have an influence on their performance. At other times, a child is motivated to get the task done out of absolute necessity. I want to give you another example of a family that I was working with that continued to wipe their child's bottom until age 5. There came a time when the parent could not leave work call to wipe the child's bottom. The child was desperate to have the task done, so he figured it out how to do it himself. After that, the child continued to wipe his own bottom from there on out. Another place the parent-child relationship and habit interfered with the child's development was in getting the child to dress themselves in the morning. The parent was eager and always ready to step in to help, but with parent coaching, we were able to help them stand back and observe and just help whenever the child absolutely needed it. In another scenario, the parent has high expectations of their child and is requesting them to do skills that are beyond the child's capability. We may be asking them to dress themselves in the morning by a certain time. In this scenario, the child's 6 years old with moderate ADHD. They keep getting distracted in their room by their own thoughts and the things in their room. They lose track of time. As parents, we can get really upset that the child isn't performing to our expectation. They did it before, why can't they do it today? The child may need some more support to address their attentional challenges. I would recommend for a parent to observe the child and see where they're getting stuck in the task. With that information, a parent can provide the needed tools and adaptations to the task. Examples of ways to adapt the task in this scenario is to break the task of dressing down into smaller, achievable pieces, such as putting on a shirt, then pants, laying out the clothes ahead of time, practicing dressing in a non-rushed environment, such as on the weekend, using timers, minimizing visual distractions like a favorite toy, using rewards for completing the task, for example. Also, it's worth noting that an occupational therapist may be the best person to observe all these different behaviors and guide the parent to see what a child may most benefit from, as well as provide appropriate problem solving and options for getting the job done that meets everybody's needs. There are 3 main practice areas within pediatric occupational therapy. The first is medically based occupational therapy, which takes place in hospitals, clinics, or inpatient or outpatient medical settings. This includes rehabilitation from a stroke or injury, birth trauma, helping people with activities of daily living, such as dressing and bathing, as well as fine and gross motor skills. The second practice area is school-based occupational therapy. In this setting, services are provided when a child is having difficulty accessing their educational curriculum. A question I hear often from parents is this: how do I know if my child is getting what they need from school-based occupational therapy? Or do they also need support at home? This is an important question, and it comes up frequently. Eligibility for occupational therapy services are determined by an IEP team, which stands for Individualized Education Program or Plan. It's important to understand that occupational therapy is not a standalone service in the education setting. A child needs to qualify for special education first. However, occupational therapy needs can still be determined in the initial assessment. In many school systems, a student must be struggling either with speech or with two academic areas that they are significantly below average in order to qualify for special education services. But that's not always the case, and there is some nuance involved with all of this. Occupational therapists in schools often focus on fine motor skills, such as handwriting, or self-regulation skills, such as classroom participation, and functional school tasks, like organizing materials or managing homework. To be clear, school-based occupational therapy is designed to support a child's success at school. A school occupational therapist works on reaching specific IEP goals. Their focus is on school-based occupations, meaning the skills needed to function in the classroom environment. This role is essential, but it is also limited to the academic setting. If the primary challenges are showing up at home, such as difficulties with daily routines, emotional regulation, transitions, sleep, self-care, or family stress, those concerns typically fall outside of the role of a school-based occupational therapist, and the school OT might not be able to help. In those cases, OT supports need to be in either a medical or private practice context, or both. Depending on the type of support needed, it may involve a different setting of occupational therapy and or other professionals, such as psychologists or another provider, depending on the underlying needs. This is where the third practice area comes in, private practice occupational therapy. A private practice occupational therapist works closely with families to identify goals for daily life at home. They look at families' routines, environments, relationships, and specific challenges occurring in navigating everyday life. The work is individualized and centered on how the child and family functions. Often, an occupational therapist in private practice has the flexibility to provide services without a diagnosis and can help guide families through the process of obtaining a diagnosis when appropriate. That said, you do not need a diagnosis to benefit from OT. Many of my clients at Oak Bloom OT are kids with ADHD and or ASD, autism spectrum disorder, but on the mild to moderate severity range, so they don't always qualify for medical services or still facing significant challenges at home and at school too. I call them my gray area kids, the gray area between neurotypical and severely impacted. It turns out that gray area kids need a lot of help to thrive. Common areas that my clients struggle with are sensory and self-regulation. They may have hypo or hypersensitivity to sensory stimulation, like sounds of everyday life or the tactile sensation of their shoes, and they have behaviors in response to this stimuli. Ultimately, occupational therapy is about helping people engage more fully in their lives. It's about understanding the whole person and identifying what is getting in the way of meeting their full potential and meaningful activities and occupation to develop the skills necessary to live life to the fullest. So now what? The first question you ask yourself is, what are the areas of occupation that my child is struggling with? Is it self-regulation, sensory, motor skills, routines, organization? An occupational therapist can assess where they're getting stuck and how to push a person toward meeting their full potential using occupation as a means. If he's struggling to stay on task at school or having disruptive behavior, then getting a meeting with teachers and staff at school and potentially taking steps towards getting support with an IEP. That IEP can qualify a child for a referral to the school occupational therapist. If your struggles are more because of a medical condition, you might talk to a doctor to refer you to a medically based OT or a private practice OT. If your kid is having a hard time with a range of issues that affect function both at home or at school, like emotional outbursts, social, academic, or self-regulation challenges, then you may need a combination of the different settings. You may need a consultation or an assessment from a private practice OT, like us at Oak Bloom OT. Thanks for listening, and don't forget to like and subscribe. We'll see you next time.